welcome to the final day of the conference. We have a full day of activities and discussions and very, very important panels. And we also have a breakout session, as we did yesterday. And we will ask you again to go to the breakout rooms, but they are a little bit different rooms. And we will put the room numbers, we will correct the room numbers for each of the breakouts on the papers we put up on the wall. So you can go and check in the next break which room number your breakout session will take place. And you will remain in the same group that you were in yesterday to continue the discussions that you were part of, but also to say that we will make again a link to the early career researcher program that we have been profiling and has been very much integrated, because in each of the three breakouts there will be representatives of the early career researcher track. As you know, we have around 25 career researchers here at the conference. So they will be in each of the groups, and you will have the opportunity, or they will have the opportunity to engage, and you will also have the opportunity to engage with the group. One part of the breakout and the other part will be to continue some of the discussions we had in the group yesterday. But what we will also do before we move on with the program is to show you the first draft of a call to action. And I would like to emphasize on behalf of the organizing committee that this is a very first draft, and it's a document we expect to present tonight again for a final presentation to all of you. But the four co-host organizations, we do not pretend to have a political mandate or a aspiration to do a declaration in the sense that of a global political mandate, but we do have a legitimacy as conveners of this meeting, and the intention with the call to action is to start a process of a global community of organizations and individuals who can support the text as it moves along. And the text is not final, and it can change. It's supposed to be a living document. So please read it in that context and with that purpose. I'll read it quickly through so that you know how far we've come with it. And you can see how much of it would resonate with your own individual and your organization's thinking of type 1 diabetes care in low resource setting. I'll read it through. It's not a very long document, and then we will move to the first panel afterwards. On the 4th to the 6th of February 25, an international meeting took place in Copenhagen under the title Type 1 Diabetes, Advancing a Global Roadmap for Improved and Integrated Care in Low Resource Settings. The international meeting on type 1 diabetes was held in the context of the WHO Global Diabetes Compact and the global diabetes coverage targets to be achieved by 2030. We, the participants of the meeting, who are engaged in type 1 diabetes care, research, advocacy, policy making, awareness raising, education, psychosocial support, or other related fields, or who are people living with type 1 diabetes, express our concern that many people living with type 1 diabetes in low resource settings are not accessing care as required, including insulin and glucose monitoring devices, and risk increased morbidity and mortality due to poorly controlled blood glucose. Number 2, we express our concern that type 1 diabetes has been less prioritized in global health development and research agendas and as part of the evolving NCD agenda due to its lower prevalence compared to other NCDs. 3, we express our concern that initiatives to improve type 1 diabetes care in low-resource settings may have been insufficiently integrated, aligned, or coordinated with national health system processes. And number 4, we express our concern that globally, an estimated 9 million people are living with type 1 diabetes, with the majority in low and middle income countries, but that the true burden and epidemiology in these settings is unknown. We, the participants of the meeting, therefore commit to the following actions: enhance multi-stakeholder collaboration at local, national, regional, and international levels, aiming to expand and improve type 1 diabetes care in low-resource settings through convergence, synergies, and scale-up of investment. We commit to accelerate processes towards sustainable and equitable modalities for access to type 1 diabetes care, recognizing the multitude of healthcare delivery systems across low-resource settings worldwide, and the specificities of accessing care in humanitarian settings. We commit to develop innovative research and data collection systems involving a wide range of stakeholders, including the active engagement of people with lived type 1 diabetes experience, to address the WHO prioritized research agenda and other research work streams, to fill existing gaps in our knowledge. And number 8, we advance a global community open to all stakeholders working in the field of type 1 diabetes, with the aspiration to share knowledge, establish new collaborations, build bridges across sectors, and to improve type 1 diabetes care. Finally, we ensure the meaningful and equal inclusion of people living with type 1 diabetes into processes at local, national, regional, and global levels concerning access to care, while recognizing the multitude of engagement mechanisms across low-resource settings worldwide. So this is the draft. And we hope you will receive it as a draft for a first step towards a community which hopefully can grow and which hopefully has had an initial platform established here in Copenhagen this week. We're not going to vote tonight or have a resolution, but we will circulate a final version tonight and coming days to all of you for your comment or for your support, and to the extent you wish to have your name or organization listed. All right, so this is it for now.